All right. Good afternoon and welcome everyone to the panel Healthcare in the Industry Innovating Its Way Out of a Crisis. My name is Davide Turi. I'm going to be your host for the next half an hour. And I'm founding partner of Studio Zao, a London-based innovation and talent development studio. We work with the world's leading organizations to apply internal entrepreneurship, or as we call it, intrapreneurship, to drive growth, resilience, and innovation outcomes. And as the world is venturing through the worst pandemic of the last 100 years, healthcare innovation has never been more important. In fact, healthcare innovation is exactly what has given us a vaccine for COVID in less than a year's time. But it's not only that. On top of this, tech applied to healthcare has produced a big shift in consumer expectations. For example, the rapid evolution of e-health has set a long-term expectation for remote services for patients. So we are lucky enough to have three amazing guests with us today to explore this topic. So we have Suzanne Ali Hassan, the head of commercial engagement for UCL Partners, Sigal Achili, a director of AI data digital innovation at NHS, and Dr. Marcus Erken, founding partner of Sunfish Partners, an early stage venture capital. So without further ado, I would like to let my guests introduce themselves quickly so that we can then kickstart this panel. Sigal, would you like to go first?
Thank you, David. Yes, so I'm Sigal. I work for Guy's and Sir Thomas NHS Trust. It's one of the largest NHS Foundation trusts in the United Kingdom. So it includes lots of services, all of acute services, cardiovascular, big cancer centre, children hospital, as well as providing healthcare services to South East London. We're also part of Health Data Science Centres, one of the UK accredited and biomedical research centre as well. As my role as Director of Artificial Intelligence, Data and Innovation, I work on some of these products and innovation that we'll talk about today in the context of COVID and beyond. Thank you.
Yeah, great. And Suzanne, how about you?
Yeah, hi, good afternoon. My name is Suzy Ali Hassan. I lead the commercial team for UCL Partners. So UCL Partners is one of the 15 academic health science networks across England, or AHSNs, you'll hear that term a lot. But we're also a membership organisation of many hospitals. We bring together 23 NHS trusts, 9 universities and 20 big commissioning organisations across North East Central London and beyond. Our main remit is to support technology embed itself within the NHS, to support industry partners gain market access within the health system and help them to understand the evidence requirements to enable adoption. Broadly, than that, we support the NHS Innovate, so we add capacity to the system, and sometimes we describe ourselves as the innovation arm of the NHS.
Yeah, that's great. Marcus, how about you?
Hi guys, great to be here. My name is Marcus. I'm founding partner of Sunfish Partners. We're an early stage VC that invests in Polish tech startups, and we currently have 3 companies in our portfolio that fit the healthcare/biotech space. Molecule One is working on software for chemists to help them speed up the drug development process. Ether Biomedical is working on next generation bionics. The first product is an artificial hand. And lastly, Solvmed Group is working on Parkinson's diagnostics. I'm very excited to be here in this panel.
Yeah, thanks. So first of all, apologies in advance. Marcus' connection, as you can hear, is not great. They apparently cut Wi-Fi to his building just today, so not great timing. But thanks, Marcus, for being here with us in any case. So with this great guest, what are we talking about? So according to McKinsey, there's been a decline in focus for innovation. And that decline during the last few months is evident across every industry they surveyed. However, there is one single exception where executives have been asked what are the top two priorities, and more executives, 30% more executives than pre-COVID, said the top one priority for them right now was healthcare, was innovation. And that industry is pharmaceutical and medical products. So my question to our guest is this. What is happening in the healthcare industry right now? Is it only because of COVID that there is this boom in innovation, or there are other applications perhaps driven by tech? And Marcus, perhaps you want to start briefly so that you are more connected with startups, so you got more a sense of a cross industry innovation there?
Sure, I'm very happy to. I think mid to long term, COVID is great for startups in the healthcare space because it's really showing us all as society how desperately needed innovations are, and how much room there really is to improve. However, does that mean that it's easier for startups right now? And I think it really does depend. I mean, maybe it is for startups on the consumer that have consumers as customers, right? We see a lot of improvements in telehealth, so it's probably easier there. Is it easier short term for startups in the business-to-business space? And the answer is probably no, because right now in times of crises, a lot of companies are, for good and bad reasons, in crisis mode, right? So they focus a lot of their energy internally. They focus on cost cutting. They're very conservative. So right now is not the time for many of them to be trying out new startups that have innovative solutions. So ironically, although this might be the solution mid to long term, for business to be probably not all that easy right now.
All right. Yeah, that's very interesting. So, Sigal, you say you work in digital innovation and AI for the biggest healthcare provider in the UK. So, what is going on? What are the latest innovations that you could see being implemented?
I think there's quite a lot going on, and it's interesting. I think in the previous panel, Innovate UK spoke about how they're fostering that innovation by funding some of these projects, and certainly through the pandemic itself, what we've seen is a lot more things like remote monitoring, the track and trace from testing at home, from things like respiratory devices that monitor your peak flow to show how your illness is progressing, that then connects back to the hospital systems or your GP practice, to things like artificial intelligence research that we've been doing in collaboration with hospitals in the UK, in Wuhan, in China, and in Oslo, for example, that look at predictive modeling for deterioration in COVID specifically. So we've been able to do that through implementing some of these new tools and technologies that would have been available to us. But I think one of the significant things that happened, that were happening already, but through the pandemic have accelerated, is that kind of way of working in terms of really, if you're not aware of this, we are a hospital, we're very risk avert because it's all about patient safety. And it does mean that there is quite a lot of bureaucracy and ways of working through processes and systems that are not always agile and innovative, if you see what I mean. And I think one of the things that really happened here is the focus of everybody across the ecosystem to create solutions and to be on the front line, to help clinicians, to help patients. And that really changed a bit of the mindset towards more kind of collaborative and fast testing of technology, particularly, and also those technologies that enable patients to communicate with their loved ones. So things like fixing on networks, that making sure there is Wi-Fi across the hospital. All those things that you would expect to be there, but not always happening in conjunction together. So I think that there is a lot of innovation always happening, and as you'll hear from Susanna as well, we're part of that network that she's talking about, and that is really quite exciting at the moment, because there's so many opportunities and so much also goodwill from all the different parts to come together and innovate together. So I think that's quite exciting.
That's great to hear. Thanks. It's very encouraging. Susanna, I was wondering, I mean, since I know that as a health science academic network, you actually engage with academia and you try to transform some of the academic research into applications for the healthcare industry. What would you say are the latest and upcoming trends in innovation for health?
Yeah, I'd say that that's right. So we're lucky in UCL Partners that we bridge that gap between the university and that sort of bench to bedside agenda really, and sort of drive out the innovation pathway into the health system. I suppose technology and innovation that is truly disruptive and interventional, and a lot of that focuses in and around diagnostics and pulling them out into the system. They can be really significant in the way they impact the way care is delivered. And in terms of how this system has innovated or looks to be innovative pre-COVID, I would say that that's perhaps where the drive had come from, is around the shift into preventative medicine. It's looking at population health, early diagnosis, rather than treatment of disease when it occurs. So sort of pulling out diagnostics, be them in vitro diagnostics or AI technology and data-driven biomarkers, etc. I'd say those are the areas really to watch in terms of the pull from the health system, from the lab itself.
No, that's very exciting. I guess it's in the interest of everyone to prevent the disease rather than to treat it, right? So that's great to hear. I was wondering, when it comes to healthcare innovation, Sigal mentioned the way we are working is changing, is more collaborative. And, we experienced this ourselves when at Studio Zhao we ran a program with one of the health academic health science network, and engaging with students at Cambridge University, for example. So I was wondering if you could expand a little bit more on exactly in which way healthcare is embracing innovation these days. And Susie, perhaps you want to continue on this, and then we move on.
Yeah, I'll just to begin really by saying that I think the NHS does want to innovate. They recognise that they need to, and I think that's where they sort of lean on organisations like UCL Partners and colleagues across the AHSNs to help them make those changes. I think our role, and perhaps the role of the supplier or the technology company driving that into the system, is around ensuring that the evidence presented to the health system is compelling, is clear, that their value proposition is concise, because it's very easy to say this is going to save the world as a sort of technology company innovating within their company, but I think it has to be realistic for the NHS to adapt to make that change. One of the areas that we really emphasise to companies approaching the NHS is around real world evidence, so very practical evidence around implementing the technology. What does it mean in real time for the doctors, the nurses, the operational staff supporting that innovation and making that change? Sometimes those considerations are slightly less considered when approaching the health system, but all of that adds to the innovation having an impact. If you don't have that real world evidence, the impact can't be realised.
Yeah, it makes sense. And I suspect getting real world evidence is not going to be super easy for any innovator, right? Because they need to have access to patients.
Absolutely.
So that's probably one of the
so it's something that we might support an innovator do, or an innovation do, is access the patients, the clinical system, and advise them on what those real world outcomes could and should be. And if you gather them once, hopefully you shouldn't have to gather them again and again and again. And it really helps scale the innovation across the system.
That's great. Sigal, I mean, you mentioned first this change in the way you are collaborating, and it looks very promising. And I was wondering, do you have like an example, something you wanted to share with us, maybe a successful case study?
We're working with quite a few companies as part of the Artificial Intelligence Centre for Value-Based Healthcare. So that's also part of King's Health Partners with King's College London, as well as Guy's and Sir Thomas, and 10 NHS trusts that are part of that, as well as companies. So we've got all sorts of big and small, from small startups in artificial intelligence to Siemens and NVIDIA, who will supply, infrastructure and MRI and ultrasound, etc. And through that, we have been doing a number of projects. So we're really setting up infrastructure across the NHS to allow us to do federated learning for data at scale, and that kind of will go from the kind of case studies, I guess, or use cases around the healthcare system will be anything from those kind of predictive in the community things that like whether it's dementia or or stroke, or whether it's maternity and fetal abnormalities, or cancer tumors, etc. So many different clinical pathways that are enabled by this infrastructure that we're creating at the moment, and that is very much bringing together industry partners and startups together with academic data scientists, together with the clinicians who are experts in those diseases. So that's a really good example of something that's happening at the moment. But there are a lot of examples. What I would say, though, is to echo some of the things that Susanna mentioned, is that the things that we need to bear in mind when working with companies is the kind of restrictions, limitations, or slowness of the NHS, because, for example, we have our own security networks, we have our own sort of rules around patient privacy, ethics around patient using patient data. So to gather that world evidence, you'll need to really understand the rules and how to operate within them, and understand the kind of how the NHS operates. And there are a number of ways to do that. So through organizations like King's Health Partners, UCL Partners, also NHSX and NHS Digital, who have a lot of these frameworks and sort of for how you engage with the NHS, and the sort of security and considerations and things like that. So they're the sort of things I would recommend being aware of when coming for companies to engage with these sort of organizations.
That's great. Thank you. That's very insightful. Marcus, I seen you tried to change your location. You went down.
Yes, I hope it works now. This is the location number 4 now.
I'm very sorry that you're experiencing this.
I'm so sorry.
I was wondering, we were hearing from Susanna and Sigal, in which way the innovation in healthcare is changing, and how the public sector, in this case, is engaging with academia, with private companies, with startups, with large organizations. I was wondering, perhaps you have something to add here, your point of view. We've been quite UK-centric so far. You're based in Germany, so and you work mostly with startups. So have you got anything to add?
Yeah, I think location isn't that relevant. So I mean, I'm based in Berlin, but for the past 4 years, sort of like my heart's been in Poland, and our fund is dedicated to Polish teams, and a lot of the teams work with the regulators in the UK, the States, and so forth. I think the one thing that the startups would probably appreciate the most is very fair expectation management. Because I mean, and this is one of the trickiest thing about the healthcare industry, right? Because there is so many stakeholders, and they all are important. And if startups really want to make it in that space, they need them in one way or another. But the one thing, obviously, to understand for regulators, big corporates, and so forth, startups are always about to run out of money, right? And the startups do understand that institutions cannot be as fast as a startup, but they very much would appreciate to learn, okay, this process is something we could try, it takes half a year, or this process, guys, this is going to take 2 years. Can you really make it for 2 years or not? And I think this is one big issue, because there's a lot of corporates out there which try to sort of like almost use the startups as their internal innovation department, right? And I think it's totally fine as a corporate to say, we're not working with startups right now, or say, guys, we're happy to do this with you, but realistically, it's going to take a year or 3. Can you do that? Yes or no? And I think a bit more transparency and clarity there would really, be a great help.
No, that's great to hear, and I'm sure the audience will find these insights very helpful. So one thing I wanted to explore, and as we are close to wrapping up the panel, is, as I mentioned, at Studio ZAO, we are focused on entrepreneurship, so enabling and empowering internal entrepreneurial talent. And I was wondering how much internal talent has been instrumental to innovation during the past few months. And I'm very keen to hear your experience. And again, if you have any example or case studies, I think it will be extremely interesting. Sigal, do you want to go first?
Sure. I mean, I think as the NHS, we struggle a bit to recruit and compete. For example, software developers, data analysts, data scientists, all sorts of skill sets that we might struggle to compete with the big kind of tech companies out there. But at the same time, we have some brilliant minds, and there's sort of, because a lot of the NHS trusts are set out with Academic Institute, we are able to share those resources, as I mentioned, of the academic data scientists, researchers, biomedical engineers, and that is really, really interesting. And we also have those kind of excellent doctors and nurses that are digital champions or digital pioneers. There's the Digital Academy that NHS England runs, which really fosters that kind of innovation in technology in healthcare. So I think that the fact that again, I really think there is a momentum in the past few years, and it's growing all the time. And the push for a kind of joint healthcare records that will enable us to have that really strong data point to understand more about patient things like the Genomic England, and it's all. We need to really upskill our workforce, and we recognize that. So there's a lot of things happening, but it's really about those collaborations, I think, with the academic and institute as well, to define what the skill sets are, what the capability gap is, and be able to recruit to that within the NHS itself, within the healthcare sector itself, in my opinion.
Yeah, it's a shift. It's a change in the way you are working, and clearly you recognize that you may lack some internal resources and also some skills to be able to innovate at scale and at pace. Susie, have you got any experience you'd like to share from your side about internal talent being instrumental for innovation in healthcare?
Yeah, I mean, I think we certainly feel that it is to the work that we do. So as I said, across our 23 hospital membership, we make a real effort to try and nurture that homegrown innovation, is kind of broadly how we describe it. And that's both by connecting the people that are innovating within the hospitals to learn from each other through networks and bringing them together around particular therapy areas or industry sectors, but also through education. So we're looking at establishing a clinical entrepreneur education program. So really kind of supplying innovating clinicians or operational staff to learn about the business behind a sort of an NHS-born innovation. How do you commercialize something? How do you spin it out of an institution? These things are kind of skills that we, perhaps because we work in this industry, take for granted, but we recognize actually there is a real capacity and skill building that's required. So that's certainly something we do locally, along with promoting and supporting local accelerators like the Digital Health London Accelerator, the NHS Innovation Accelerator, and others, and the pioneers, as Sigal says. So there are a few mechanisms. It's a very important part of what we want to do.
It seems like it's a thriving and exciting environment to be in. And on top of this, obviously, everyone is working to improve the patient's health. So that's an additional sense of purpose that I'm sure is fulfilling your roles. Marcus, to conclude, I wanted to get your point of view on the role of internal entrepreneurial talent for pushing forward innovative projects in healthcare.
I think it's one way that's important and one way in which it can help. But I think it's important to understand, and there might be exceptions here or there, but the radical innovations hardly ever come from the inside. And I don't think the healthcare industry in the next couple of years is going to be any exception to that. That's how it's always been in any industry. And there's a lot of good reasons for that, mostly structural, right? But to be really innovative, in the end, you have to be sort of like willing to sacrifice their own existing company. And that is something, understandably, that although the marketing talk might be different, no organization I've ever met has a real interest in doing that. So I do think it's important to realize what internal talents and innovation and entrepreneurship can do and what it cannot, because it can do certain things, but when it comes to like really broadening the horizon or seeing sort of like stuff that might in the end attack things from very different angles, that might not come out of the existing hierarchy, but might come from the outside. And you'll have to acquire this talent via the companies or work with them in a serious way, and that means sort of like making deals with them. I think, by the way, that's the one thing most startups would appreciate, because I think it's wonderful to see, and this is a phenomenal step in the right direction, the great networking opportunities and so many learning opportunities. The one thing that I think is still missing from many organizations is giving more deals to startups. And I understand that it's not always in the interest and you cannot always give the startup the deal. But if only that likelihood increases by 10 or 20%, like actually giving those companies a deal and revenues and ways to learn and engaging them not as a mentee, but as an actual client, a customer, a service provider, I think that's the biggest learning opportunity, and that's also the best way to see if they might fit internally or not.
Yeah, I appreciate, an external point of view is probably sometimes required to see opportunities that are under your eyes all the time, and internal people may not be able to see. On the other hand, I suspect internal people are needed for external organization to come and deploy successfully any initiative, isn't it?
Yeah, I really think that it's a mix. It's sort of like different skill sets are needed, and there's different tasks in which one or the other will be the better choice.
All right, thanks. I would like to thank you for being with us, and thanks also to our audience for staying with us during this last half an hour. We could surely prolong this conversation for at least another hour, because there are so many interesting things and insights, and I understand opportunities in the healthcare environment which are there, and and are free for anyone to seize. But for now, I would like to thank you very much, Sigal, Susie, and Marcus, for being with us, and best of luck with your endeavors.
Thank you so much.
Thank you.
Bye-bye.
Thank you.
Thank
Bye.
you.
Bye. Bye. Bye.